So we've been watching Republican politicians and legislatures and conservative media whip up this frenzy about critical race theory. And amidst that frenzy, it's easy to lose sight of what exactly critical race theory is, what it's about, and partly because it's complicated. The way that I think about it is really this is a debate about how central we think race, and particularly anti-black racism, is to America, how central it is to American life throughout our history and into today. That is fundamentally the debate we are as a society having. And so I thought it'd be a good idea to show you some data I think is useful to think about in that context. When you ask yourself, is race a side story in America or an essential one in this country? Now, this comes from a pre-publication study in the Health Affairs Journal, and it looks at the increase in mortality rates across different groups of folks during the pandemic. Now, of course, we already know COVID disproportionately affected people of color. Black people have died at 1.4 times the rate of white people, according to the data compiled by the COVID Tracking Project. Indigenous and Hispanic people have died at higher rates than white people as well. This new data breaks it down even further. This graph shows the increase in deaths, all causes, so-called all-cause mortality, from the second quarter of 2019 to the second quarter of 2020. Now, that's about 3 months into the pandemic, right? So this first grouping of bars on your left side of the screen shows the increase in deaths per 100,000 people among uninsured people. Those are people that don't have health insurance, who you'd think would have a pretty high rate. Now, you've got uninsured Hispanic people, that's the yellow bar. Non-Hispanic others, it's Asian, Pacific Islander, Indigenous folks, that's in red. And then non-Hispanic white people in blue. That's Hispanic, Asian and Indigenous, and white folks in blue. Now, we've added in the last group here, and that's Black Americans, represented by the teal bar. Now, look at that. Deaths among uninsured Black folks went up nearly 3 times more than uninsured white folks. Okay, let's look at insured people. See that? See that teal bar again? Similar. Deaths among insured Black Americans increased 5 times more than among insured white Americans. In fact, you were better off being an uninsured white person than being a Black person with health insurance. Well, what about income? Maybe this is just an income proxy effect. How about when you break it down by income? This data is from families whose income is below the federal poverty level. These are people $26,200 for a family of 4 last year. Again, you see that teal bar? Way, way above the others. Deaths increased 6 times more among poor Black families than poor white families. When you look at families making up to 4 times the federal poverty level, okay, that's middle-class families. Guess what? Basically the same story. Deaths were up 5 times more among Black folks than white folks. Even with people in the middle class, families making over $100,000, more than 4 times the federal poverty level, there was a 5 times greater increase in deaths among Black people than white people. In fact, once again, you are better off being a very poor white person than a middle-class Black person in terms of your risk of death during the pandemic. Another way of breaking it down is by whether or not you can work from home, right? That's been a particularly important factor, of course, during the pandemic. In the aggregate, there was a bigger increase in deaths among people who had to go to work in person versus people who could work from home. But look what happened to mortality, even among Black folks who could work from home. An 8 times greater increase than among white folks who could work from home. And for people who had to go into their places of work, deaths among Black folks increased about 3 times more than white people. Once again, you were better off being a white person who had to go to an in-person job every day throughout the first few months of the pandemic than being a Black person who had the option to work from home. Across all of these different subcategories, one thing remains constant. All of those really tall teal bars, towering over a bunch of small bars, those are Black Americans dying at higher rates, no matter how you slice the data. What you are looking there on your screen, when you look at these graphs, is the ubiquity of race, particularly structural racism against Black people that has existed in this country since before its founding. That has produced the conditions where we have a population in this country that is more vulnerable to a respiratory virus, a virus that, of course, has no idea what race anyone is. Because of all that population has been subjected through the years, through segregation, dispossession, leading to Black people living in areas where poor air quality and having much higher rates of comorbidities, all the accrued legacy of structural racism. This is the result. This is what it looks like when people make the argument that race, that anti-black racism in particular, is the central story in this country. These graphs show what that means in a tangible sense for arguably the most important thing we have for all of us, which is how long we get to stay on this planet.